And so what I'd love to just take a moment, I know that all of us have an array of anecdotes in their head of like, wow, that really influenced me. And it could be in terms of how you think about inclusion on a more personal level, or even as we think about it more systematically, right? If there's a story that you would like to share, because to Janice's point, I think there's a lot of power in storytelling. So Joni, if you're all right, I thought I would start with you.
Sure. It's an interesting thing that you say. I think that that the affinity bias is real and present, and I think I don't know that I recognized it as much until I became the director of NCATS and kind of had a different vantage, I guess, of the workforce and what we needed to do to create a culture and an environment that would be safe for people to bring thoughts, ideas, concerns all to the table. They can't all bring them to me. They need to bring them to their supervisors, and then and then go forward in that way. But what I started to see was that there were pockets of this affinity bias, and so I think that the idea of recognizing that is so important. And I think also, as I went through my career as a geneticist, working in the field of genetics, I started to be a part of the All of Us research program when it was just beginning. And the important factor there that I think is going to make all of us really powerful is that we made a call up front that we needed to make sure that we had a majority of the minority populations included. And that was not an easy sell out of the gate, because people were used to bringing in people who were like them when they're involved in research activities. So we made a very big point that we actually may slow down because we need you to do this in the way where we bring in a majority minority. And because we said we are not going to just start off and then go back, that wouldn't work. Mm-hmm. So we started out from the very beginning doing that. And I think that today that still holds true how it is playing out. And I'm really gratified to see that. So I think...
And you had a scientific rationale for doing it that way.
We did.
Which I think is very powerful.
That's right.
In persuading others.
We needed to do that.
Yes.
Yeah, the genetics community, as you know, a lot of the research findings were in the white Caucasian population. That had to change.
Yeah.
And the other things that I learned there, though, were how to be inclusive. So you can't just say, I want to do this. I want to go get these populations. Right. It's not about helicoptering in. It's actually about engaging them. So we supported groups and communities that we wanted to be at the table. And we also made sure that our consent forms were in another language. Spanish was the one we started with. And even then, you can't just do a direct translation. We learned that the word study turned into investigación. And that culturally is not a good word for the Hispanic population. So including the communities, the Hispanic communities, to help us identify those kinds of issues that related to the cultural needs of the community was super important. So I can't estimate it, or I can't say enough how much of value it is to bring in this importance of inclusivity, to make those pivotal moments that you don't necessarily see immediately, but by including those individuals who can help you navigate those issues, they can help drive those points home and make sure that your studies are well designed in that way. We have a long way to go still in many areas, but I think that that's certainly been a lesson that stuck with me for quite a while.
Anyone else from the group have something they want to share?
I'm happy to, yes. As you were just talking, I thought about, and your story as well, I'm just thinking about the pivotal moments. And for many of us, especially if you're coming from the background where you're in a population that's typically underserved, it's not just about one moment. It's all of the moments, and you live it every single day. Yep. I'll give you some examples. George Floyd, what happened during the pandemic in 2020, that confluence of both the social challenges that erupted as well as a health emergency. And I had many colleagues come to me to say, wow, I didn't know that was your experience. How are you feeling about being a Black woman in America? I'm like, well, this is every day. This is not just this particular moment. It may be acute for you, but this is the context in which we get up and take care of our families and go to work and lead organizations and identify issues. And what that in some ways reflects is that we just need to be cognizant, again, of what I said earlier, who you have around the table, because they bring those experiences to bear. So it's not just one moment for me, but it's all of those moments. The second is that as I think about those who are suffering from different disease conditions, you were talking about the All of Us research study, Joni. For much of the research issues and the disease areas that we're studying, the impacted populations are racial and ethnic minorities. Of course, it's historical. Of course, it's systematic and systemic in this country. But we have to really be intentional about how we are choosing to address those challenges. And we're going upwards, and we talked about this too, Janet. 40% of the U.S. population is going to be, racial and ethnic minorities, and then in some cases for maternal and child health, an issue I worked on early in my career, 40% or 4 times more likely, right, these Black women to have poor health outcomes, cardiovascular disease, cancer. I mean, just go down the list. At some point, we have to get embarrassed and say that, at some point we have to say, this is not okay compared to other high-income countries. These are the health outcomes that we are okay with continuing as status quo. We cannot continue a status quo. And so all of these moments for me, they add up. My father died 1.5 years ago from cancer. He was diagnosed at stage 4. We are fortunate that even in that late diagnosis, he had access to some of the best medical care. Of course, we had to be very involved as family caregivers. But that also is a call to action. Are individuals like him included in clinical trials and clinical research? Do we give a voice to those who are voiceless? So as I think about my career, I really see this call to action because I'm invited to be around all the tables, a lot of tables, Joni's table and Janet's table and others, and Janice's table and so forth, to give voice to the voiceless and to say we need to be intentional. We cannot all just dwell on one moment. For many of us that live it, it's all about our lives every single day. And how do we ensure that the solutions that we are developing are not, we developed this for you, but you're with us identifying and helping co-create and co-construct those solutions together.
And that's where I think with the pandemic, it maybe for most was, maybe that highlighted a lot of the issues. They've always been there, right? We would talk about inclusivity in clinical research, but unless you're measuring it and really understanding it, you have to have a baseline. And we made a conscious effort to publish 10 years worth of data on our clinical trials, and it wasn't good, right? But it set a baseline for us, kind of like that call to action. And when we were developing the vaccine, what we realized is that it has to be for everyone. And of course, you always know this, but to your point, you have to be intentional. And so we got really intentional about the sites we were choosing, making sure they were in the right areas. We got very intentional about, can you have after office hours? Can you have things on weekends? And at times we would actually pause recruitment at some of the sites if they weren't, hitting the targets that we needed. So we had to get very intentional about everything that we did, finding the right influencers, et cetera. I think that was a moment for me that you realized, if we can do that for COVID, why aren't you doing it for everything else, right? Why did that have to be the moment, right? That, and if you're doing all these different
But I'm glad
things.
it was the moment.
I think we're all glad it was the moment, but now how do you take that and continue
How do we
it?
not backslide?
Yes,
That's right.
exactly.
And that's always the worry. Like, how do you keep us sort of on the right path? Right? It's always easy to slide back.
It's
Janice, yeah.
intentionality plus consistency. I think, the quote says, to drive lasting, enduring change requires one step at a time. And leadership is not an event, or you drive change. You don't you don't go to the gym for 9 days and expect to be transformed, right? You gotta keep at it. I mean, some of us might, but right. Or we were talking about orchids, and I can't just go dump a bunch of ice cubes, which apparently not the right way to do it. You can't expect success, right? And it's not an event. It's not an intensity. It's about being consistent and believe in the cause. And weathering through the barriers, but really lead by example. I tell my kids, and it's easier said than done. It's choosing to do the right thing even when it's the harder thing to do. That's key.
And I think as leaders, we are in a position to not just say those types of things, but also to recognize the infrastructure inequities in the communities, and that we want to continue to be consistent and intentional with. And that takes time, it takes money, it takes workforce development, it takes resources. And I think that there needs to continue to be an intentionality behind our ability to build that infrastructure to make sure that we're setting ourselves up for success for the future.
Yeah.